Hepatitis. Definition. Hepatitis refers to an inflammatory condition of the liver. It's commonly caused by a viral infection, but there are other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs as a secondary result of medications, drugs, toxins, and alcohol. Autoimmune hepatitis is a disease that occurs when body makes antibodies against liver tissue. Hepatitis means inflammation of the liver. Many illnesses and conditions can cause inflammation of the liver, for example, drugs, alcohol, chemicals, and autoimmune diseases. Many viruses, for example, the virus causing mononucleosis and the cytomegalovirus, can inflame the liver. Hepatitis means inflammation of the liver. The liver is a vital organ that processes nutrients, filters the blood, and fights infections. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxins, some medications, and certain medical conditions can cause hepatitis. However, hepatitis is often caused by a virus. Transmission. Hepatitis A and hepatitis E typically spread through contact with food or water that has been contaminated by an infected person's stool. People may also get hepatitis E by eating undercooked pork, deer, or shellfish. Hepatitis B, hepatitis C, and hepatitis D spread through contact with an infected person's blood. Hepatitis B and D may also spread through contact with other body fluids. This contact can occur in many ways, including sharing drug needles or having unprotected sex. Classification of hepatitis based on duration of illness. The hepatitis A and E viruses typically cause only acute, or short-term, infections. In an acute infection, body is able to fight off the infection and the virus goes away. The hepatitis B, C, and D viruses can cause acute and chronic, or long-lasting, infections. Chronic hepatitis occurs when body isn't able to fight off the hepatitis virus and the virus does not go away. Chronic hepatitis can lead to complications such as cirrhosis, liver failure, and liver cancer. Acute fulminant hepatitis. Rarely, individuals with acute infections with HIV and HBV develop severe inflammation, and the liver fails, acute fulminant hepatitis. These patients are extremely ill with the symptoms of acute hepatitis already described and the additional problems of confusion or coma, due to the liver's failure to detoxify chemicals, as well as bruising or bleeding, due to a lack of blood clotting factors. In fact, up to 80% of people with acute fulminant hepatitis can die within days to weeks. Therefore, it is fortunate that acute fulminant hepatitis is rare. For example, less than 0.5% of adults with acute infection with HBV will develop acute fulminant hepatitis. This is even less common with HCV alone, although it becomes more frequent when both HBV and HCV are present together. Chronic viral hepatitis. Patients infected with HBV and HCV can develop chronic hepatitis. Doctors define chronic hepatitis as hepatitis that lasts longer than 6 months. In chronic hepatitis, the viruses live and multiply in the liver for years or decades. For unknown reasons, these patients' immune systems are unable to eradicate the viruses, and the viruses cause chronic inflammation of the liver. Chronic hepatitis can lead to the development over time of extensive liver scarring, cirrhosis, liver failure, and liver cancer. Liver failure from chronic hepatitis C infection is the most common reason for liver transplantation. Chronic viral hepatitis can transmit the infection to others with blood or body fluids, for example, sharing needles, sexually, and infrequently by organ donation, as well as infrequently by transmission from mother to newborn. Causes of viral hepatitis. Hepatitis A, HIV. The hepatitis caused by HIV is an acute illness, acute viral hepatitis, that never becomes chronic. At one time, hepatitis A was referred to as infectious hepatitis, because it could be spread easily from person to person like other viral infections. Infection with hepatitis A virus can be spread through the ingestion of food or water, especially where unsanitary conditions allow water or food to become contaminated by human waste containing hepatitis A. The fecal-oral mode of transmission. Hepatitis A typically is spread among household members and close contacts through the passage of oral secretions, intimate kissing, or stool, poor hand washing. It also is common to have infection spread to customers in restaurants and among children and workers in daycare centers if hand washing and sanitary precautions are not observed. Hepatitis B, HBV. HBV hepatitis was at one time referred to as serum hepatitis, because it was thought that the only way HBV could spread was through blood or serum, the liquid portion of blood, containing the virus. It is now known that HBV can spread by sexual contact, the transfer of blood or serum through shared needles in drug abusers, accidental needle sticks with needles contaminated with infected blood, blood transfusions, hemodialysis, and by infected mothers to their newborns. The infection also can be spread by tattooing, body piercing, and sharing razors and toothbrushes, if there is contamination with infected blood. About 5% to 10% of patients with HBV hepatitis develop chronic HBV infection lasting at least 6 months and often years to decades, and can infect others as long as they remain infected. Patients with chronic HBV infection also are at risk of developing cirrhosis, liver failure, and liver cancer. Hepatitis C, HCV. HCV hepatitis was previously referred to as non-A, non-B hepatitis, because the causative virus had not been identified, but it was known to be neither HAV nor HBV. HCV usually is spread by shared needles among drug abusers, blood transfusion, hemodialysis, and needle sticks. Approximately 75% to 90% of transfusion-associated hepatitis is caused by HCV. Transmission of the virus by sexual contact has been reported, but is considered rare. An estimated 75% to 85% of patients with acute HCV infection develop chronic infection. Patients with chronic HCV infection can continue to infect others. Patients with chronic HCV infection are at risk for developing cirrhosis, liver failure, and liver cancer. Types D, E, and G hepatitis. There also are viral hepatitis types D, E, and G. The most important of these at present is the hepatitis D virus, HDV, also known as the Delta virus or agent. It is a small virus that requires concomitant infection with HBV to survive. HDV cannot survive on its own because it requires a protein that the HBV makes, the envelope protein, also called surface antigen, to enable it to infect liver cells. The ways in which HDV is spread are by shared needles among drug abusers, contaminated blood, and by sexual contact, essentially the same ways as HBV. Individuals who already have chronic HBV infection can acquire HDV infection at the same time as they acquire the HBV infection, or at a later time. Those with chronic hepatitis due to HBV and HDV develop cirrhosis, severe liver scarring, rapidly. Moreover, the combination of HDV and HBV virus infection is very difficult to treat. Hepatitis E virus, HEV, is similar to HAV in terms of disease, and mainly occurs in Asia where it is transmitted by contaminated water. It causes acute hepatitis. Hepatitis G virus, HGV, also termed GBVC, was recently discovered and resembles HCV, but more closely, the flaviviruses. The virus and its effects are under investigation, and its role in causing disease in humans is unclear. Incubation period. Type A hepatitis. Incubation period, 3 to 5 weeks. Prodromal symptoms, fatigue, anorexia, malaise, headache, low-grade fever, nausea, vomiting. Highly contagious at this time, usually 2 weeks before onset of jaundice. Icteric phase, jaundice, tea-colored urine, clay-colored stools, right upper quadrant pain and tenderness. Symptoms often milder in children. Type B hepatitis. Incubation period, 2 to 3 months. Prodromal symptoms, insidious onset fatigue, anorexia, transient fever, abdominal discomfort, nausea, vomiting, headache. May also have myalgias, photophobia, arthritis, angioedema, urticaria, maculopapular rash, Vasculitis. Icteric phase occurs 1 week to 2 months after onset of symptoms. Type C hepatitis. Incubation period, 6 weeks to several months. Similar to HBV but less severe. Type D hepatitis. Unclear incubation period. Similar to HBV but more severe. Risk factors. People who are most at risk for developing viral hepatitis are workers in the healthcare professions, Asians and Pacific Islanders, sewage and water treatment workers, people with multiple sexual partners, intravenous drug users, HIV patients, people with hemophilia who receive blood clotting factors. Causes of non-infectious hepatitis. Alcohol and other toxins. Excessive alcohol consumption can cause liver damage and inflammation. This is sometimes referred to as alcoholic hepatitis. The alcohol directly injures the cells of liver. Over time, it can cause permanent damage and lead to liver failure and cirrhosis, a thickening and scarring of the liver. Other toxic causes of hepatitis include overuse or overdose of medications and exposure to poisons. Autoimmune system response. In some cases, the immune system mistakes the liver as a harmful object and begins to attack it. It causes ongoing inflammation that can range from mild to severe, often hindering liver function. It's 3 times more common in women than in men. Pathophysiology. Sign and symptoms. Many patients infected with HIV, HBV, and HCV have few or no symptoms of illness. For those who do develop symptoms of viral hepatitis, the most common are flu-like symptoms including loss of appetite, nausea, vomiting, fever, weakness, tiredness, aching in the abdomen. Less common symptoms include dark urine, light-colored stools, fever, jaundice, a yellow appearance to the skin and white portion of the eyes. Diagnostic evaluation. History and physical exam. To diagnose hepatitis, first the doctor will take history to determine any risk factors client may have for infectious or non-infectious hepatitis. During a physical examination, doctor may press down gently on abdomen to see if there's pain or tenderness. Doctor may also feel to see if liver is enlarged. If the skin or eyes are yellow, doctor will note this during the exam. Liver function tests. Liver function tests use blood samples to determine how efficiently liver works. Abnormal results of these tests may be the first indication that there is a problem, especially if client doesn't show any signs on a physical exam of liver disease. High liver enzyme levels may indicate that liver is stressed, damaged, or not functioning properly. Other blood tests. If liver function tests are abnormal, the doctor will likely order other blood tests to detect the source of the problem. These tests can check for the viruses that cause hepatitis. They can also be used to check for antibodies that are common in conditions like autoimmune hepatitis. Ultrasound. An abdominal ultrasound uses ultrasound waves to create an image of the organs within abdomen. This test allows doctor to take a close at liver and nearby organs. It can reveal fluid in abdomen, liver damage or enlargement, liver tumors, abnormalities of gallbladder. Sometimes the pancreas shows up on ultrasound images as well. This can be a useful test in determining the cause of abnormal liver function. Liver biopsy. A liver biopsy is an invasive procedure that involves doctor taking a sample of tissue from liver. It can be done through skin with a needle and doesn't require surgery. Typically, an ultrasound is used to guide doctor when taking the biopsy sample. This test allows the doctor to determine how infection or inflammation has affected liver. It can also be used to sample any areas in liver that appear abnormal. Management. Treatment of acute viral hepatitis and chronic viral hepatitis are different. Treatment of acute viral hepatitis involves resting, relieving symptoms and maintaining adequate intake of fluids. Treatment of chronic viral hepatitis involves medications to eradicate the virus and taking measures to prevent further liver damage. Acute hepatitis. In patients with acute viral hepatitis, the initial treatment consists of relieving the symptoms of nausea, vomiting, and abdominal pain. Supportive care. Careful attention should be given to medications or compounds, which can have adverse effects in patients with abnormal liver function, for example, acetaminophen, Tylenol and others, alcohol, etc. Only those medications that are considered necessary should be administered, since the impaired liver is not able to eliminate drugs normally, and drugs may accumulate in the blood and reach toxic levels. Moreover, sedatives and tranquilizers are avoided because they may accentuate the effects of liver failure on the brain and cause lethargy and coma. The patient must abstain from drinking alcohol, since alcohol is toxic to the liver. It occasionally is necessary to provide intravenous fluids to prevent dehydration caused by vomiting. Patients with severe nausea and/or vomiting may need to be hospitalized for treatment and intravenous fluids. Acute HBV is not treated with antiviral drugs. Acute HCV, though rarely diagnosed, can be treated with several of the drugs used for treating chronic HCV. Treatment of HCV is recommended primarily for the 80% of patients who do not eradicate the virus early. Treatment results in clearing of the virus in the majority of patients. Chronic hepatitis. Treatment of chronic infection with hepatitis B and hepatitis C usually involves medication or combinations of medications to eradicate the virus. Doctors believe that in properly selected patients, successful eradication of the viruses can stop progressive damage to the liver and prevent the development of cirrhosis, liver failure, and liver cancer. Alcohol aggravates liver damage in chronic hepatitis and can cause more rapid progression to cirrhosis. Therefore, patients with chronic hepatitis should stop drinking alcohol. Smoking cigarettes also can aggravate liver disease and should be stopped. Medications for chronic hepatitis C infection include oral duclitosvir, Duclinza, oral ledipasvir sofosbuvir, Harvoni, Pyrethapravir ritonavir onbethasvir plus dasabuvir and ribavirin, Simipravir plus sofosbuvir, Duclitosvir plus sofosbuvir, Pyrethapravir ritonavir onbethasvir plus dasabuvir. Medications for chronic hepatitis B infection include oral entecavir, Baraclude, oral tenofovir, Vired. Because of constantly ongoing research and development of new antiviral agents, the current list of medications for chronic hepatitis B and C infections is likely to change every year. Many of those drugs which are currently available are rarely used because of newer, safer, and more effective alternatives. Autoimmune hepatitis. Corticosteroids, like prednisone or budesonide, are extremely important in the early treatment of autoimmune hepatitis. They are effective in about 80% of people with this condition. Azathioprine, Imurin, a drug that suppresses the immune system, is often included in treatment. It can be used with or without steroids. Other immune-suppressing drugs like mycophenolate, Celcept, tacrolimus, Prograf, and cyclosporine, Neoral, can also be used as alternatives to azathioprine for treatment. Fulminant hepatitis. Treatment of acute fulminant hepatitis should be done in centers that can perform liver transplantation, since acute fulminant hepatitis has a high mortality, about 80%, without liver transplantation. Prevention. Hygiene. Practicing good hygiene is one key way to avoid contracting hepatitis A and E. If you are traveling to a developing country, you should avoid local water, ice, raw or undercooked shellfish and oysters, raw fruit and vegetables. Hepatitis B, C, and D contracted through contaminated blood can be prevented by not sharing drug needles, not sharing razors, not using someone else's toothbrush, not touching spilled blood. Hepatitis B and C can also be contracted through sexual intercourse and intimate sexual contact. Practicing safe sex by using condoms and dental dams can help decrease the risk of infection. Vaccines. The use of vaccines is an important key to preventing hepatitis. Vaccinations are available to prevent the development of hepatitis A and B. Experts are currently developing vaccines against hepatitis C. A vaccination for hepatitis E exists in China, but it isn't available in the United States. Complications. Chronic hepatitis B or C can often lead to more serious health problems. Because the virus affects the liver, people with chronic hepatitis B or C are at risk for chronic liver disease, cirrhosis, liver cancer. When the liver stops functioning normally, liver failure can occur. Complications of liver failure include bleeding disorders, a buildup of fluid in abdomen, known as ascites, increased blood pressure in portal veins that enter liver, known as portal hypertension, kidney failure, hepatic encephalopathy, which can involve fatigue, memory loss, and diminished mental abilities due to the buildup of toxins, like ammonia, that affect brain function, hepatocellular carcinoma, which is a form of liver cancer, death. People with chronic hepatitis B and C are encouraged to avoid alcohol because it can accelerate liver disease and failure. Certain supplements and medications can also affect liver function.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.